The topic for this presentation is office ergonomics, and my name is Tom Haney. Let me explain first of all, ergonomics is the science of trying to fit workplace conditions and job demands to the capabilities of the worker. We never want to exceed the worker's capabilities or we put them at risk for injury. We often think of ergonomics in terms of manual labor, things that are more construction-based or something, but the reality is there are a lot of us who now work in a workstation or at a desk, and we are seated most of the day, and we do find now that there is another group of people who are dealing with workplace injuries that are related to their office work. So the goal of this presentation is to try to help you to understand and prevent soft tissue injuries such as muscles, tendons, nerves, joints. And the ones that are most common in a workplace environment are carpal tunnel syndrome, tendinitis, back strain, and sprain. So we're going to focus on those today and see if we can give you some help as to how to avoid these problems. So these slides will hopefully help you to understand and identify the risk factors and to give you some ideas of how to improve the ergonomics of your work activity. So let's start with an understanding of ergonomics. All ergonomic injury begins with fatigue. That's the starting point. So what we then did is try to figure out, well, what causes fatigue? And we have narrowed it down to 6 what we now call ergonomic risk factors. And they're listed here. Force, whether you're lifting, carrying, pushing, pulling, grasping, pinching, or striking, if you have to put a lot of effort into it, well, of course that can cause fatigue. But that's not surprising. Hard work equals fatigue? Sure. But we now know that work doesn't have to be hard to be fatiguing. It can also be repetitive. So we have a category of ergonomic injury we call repetitive motion injury. And that may be far more important in this discussion of office ergonomics. There are also environmental considerations that we look at, things like hot, cold, light, noise, dust, and fumes, to give you some idea of some of the other considerations we might look at and how they might contribute to fatigue. Duration is an important consideration because we do know that the antidote or cure for fatigue is rest. So by deciding how we can build in rest periods into the work requirements, we have a way of managing fatigue over the long haul. Vibration, we do know that certain equipment vibrates, and as a consequence of that it causes blood vessels to narrow down, limiting blood flow, which ultimately leads to fatigue. And then posture, and that's a big one. How your body is aligned to the task that you're doing can either contribute to fatigue or help to manage fatigue. So we'll try to deal with all of those in some fashion and see how they relate to the things you might experience in an office environment. So the key risk factors we're going to associate here are postures, particularly awkward postures, repetition, and force, having to do things with some degree of effort. These risk factors individually can cause problems, but we do know is that if we experience them in multiples, the risk of an injury goes up rather dramatically. Now the injuries we're talking about primarily are injuries to the hand and wrist, with carpal tunnel syndrome being the most serious, and neck and back sprain and strain. So we'll focus on those today, although there obviously are other injuries that could occur from ergonomic causes. These are the ones that are most typical in a office work environment. So this is kind of the flow chart. This is what happens, and this is so you get a sense of how things progress from simple fatigue to an injury. The fatigue is the enemy, that's the starting point. Now we try to manage fatigue by intermittently allowing breaks and recovery periods, and by using certain kinds of equipment that would require less poor postural positions or force. That overuse or fatigue may result in what I call ache and pain, or the symptoms. Now these symptoms could be as simple as discomfort, swelling in a joint, inability to move freely. But the reality is these symptoms are not necessarily injuries, but they are a sign that your body doesn't like how you're doing or what you're doing. So the idea is to be aware of the symptoms and try to express those as a potential problem so that we can act on them accordingly. that ache and pain or symptoms can result in a process called inflammation. Now, inflammation I refer to here as the problem because it is the inflammatory process that tends to break down otherwise healthy tissue and cause your body to become weaker or certain joints to become weaker, and the ultimate result is over time it results in an injury. That's the process that we want to avoid. So when I talked about symptoms, these are some of the symptoms that you might experience, of course. Numbness or burning or pain, tingling, burning, itching, tickling, and numbness are fairly common in things like carpal tunnel syndrome that give you an idea that perhaps there is something happening that your body is not reacting to well. But cramping and stiffness, decreased range of motion, you can see the list. These are things you would want to be aware of and sensitive to, realizing they don't necessarily mean injury, but they do mean you need to reassess what you're doing or how you're doing it. So how do you deal with this ache and pain and inflammation? Well, these are the basics. First of all is rest. That is the way you allow your body an opportunity to recover. Now, the rest could be a short-term break from what you're doing, or it could be a more prolonged period of time, but that rest is one way to help reduce the inflammation, ache, and pain. Correcting the postures, now that's a big one. We need to put your body in the strongest position for doing the task that you're required to do. Removing the mechanical irritant, what does that mean? Well, if you know that there's a particular movement or posture that causes you irritation, then it takes a little creativity to figure how am I going to work around that? How can I still do my job without putting myself into those positions? Takes a little creativity, but you can do it. Improving strength doesn't necessarily mean joining a gym and lifting weights, but it means using the appropriate equipment that will allow you to reduce fatigue, so you don't have to put in the same amount of effort or force, or that you can put your body in a more comfortable or neutral position. And then the use of ice happens to be a fairly effective anti-inflammatory and pain reducer. The concept here is by periodically using ice when you're experiencing symptoms, it may allow you to calm the problem down and allow your body an opportunity to recover. I'm not a big proponent of the use of heat. Not that heat can't work. Sometimes it's what is called for, but the reality is heat can cause more inflammation and bring on more of a problem in terms of the inflammation and the associated pain and disability. Time is a factor that we have to consider in this, and that is what we want to do is realize that we want to minimize those risk factors, and by minimizing them, sometimes you can't completely avoid them, but trying to avoid how long or control how long you're in an uncomfortable postural position or how much exposure you're going to get to those particular risk factors. So balancing the exposure to the risk factors with rest periods is one way to manage the process. So doing an ergonomic assessment has value. That gives you a chance to really understand what you should do, what is the appropriate posture and positions, and how do I get myself into those. So by looking at the information we're going to provide you, you may be able to do a self-assessment or do it for one of your coworkers to help them understand how they're doing and what they're doing and whether or not it puts them at risk. So it's helping you to identify risk and reducing or eliminating that risk by some sort of readjustments. So the first one is to minimize awkward postures. We do know that if your body is in a strong, stable position, it is less likely to experience fatigue, inflammation, and injury than if it's in a weak or unstable position. So figuring out what is the best postural position makes a difference. This is a simple list of those things that we look for when someone has a seated job, which of course is typically what happens in an office environment. First of all, you want to keep the three natural curves of your spine. So a nice ergonomically designed chair with a lumbar support will help you to maintain the normal curvatures of your spine. Your feet should be supported, not dangling. If you're short enough that your feet don't touch the ground, a footrest will help to control that. Keeping your ear over your shoulder. What does that mean? Well, the reality is that for a lot of us, because we're looking at the work on our desk or staring into our monitor, is that we end up with a rounded upper back posture, a head forward, head and neck forward posture in front of the center of gravity. Ideally, you would like your head to be balanced over your spine to minimize the amount of stress that you're putting on the cervical spine, your neck area, and the muscles of your upper back and neck, which often get achy after a day of sitting at your desk. Sometimes it may even be contributing to a tension headache because it limits the blood flow. So the idea is to try to find that, and one of the ways of keeping your ear over your shoulder is to tuck your chin. By simply pulling your chin in, it allows you to bring your head back over the spine where it belongs. So in terms of a sitting posture, let's go through some of these basic understandings. Is that your back should be fully supported by your chair. This is what we call neutral posture. If we dropped a plumb line from the ceiling, it should go through your ear, your shoulder, your elbow, and your pelvis. That would be an ideal posture. And so you do that by keeping your rear end back in the chair. This is not something you should be sitting on the edge of your chair. That's something you should put your rear end back in the chair. Your back should actually be in contact with the seat back to help to maintain that postural position. Your elbows should be directly below your shoulder, and your elbow to your fingertips should be parallel to the ground. That's the basic posture that you're trying to attain in order to put yourself in an ergonomically strong position. Occasionally, you may need to, for back comfort, because maintaining any fixed position for prolonged periods can put you at some risk for fatigue, is that there are some adjustments you can do. By a slight forward tilt, or a slight backward tilt, these do change the angle at your hips and may make it more comfortable for you to sit in the chair for prolonged periods of time. So the goal here is it's almost like driving a car. If you're driving for a long period of time, we recommend that periodically you move your seat. Move it forward, move it back, change the angle at the back support, because all of those will give your body a chance to rest and recover. Standing postures are similar. Now, some of you may have standing workstations, or you may have a job that requires you to actually stand. If that's the case, then the same plumb line should be similar, and that is, it should go through your ear, your shoulder, your elbow, your pelvis, and the middle of your foot. That's the posture that you should be in if you're going to be standing, or particularly if you're going to be standing for long periods of time. So, adjust your chair. If you're lucky enough to have a chair that has adjustments, use that in order to accomplish what we just described. Ear over the shoulder, elbows directly below the shoulders, so you're not here and you're not here, but at that correct angle, and elbows to fingertips parallel to the ground, so you're not working here and you're not working here. That's the idea of trying to use the adjustments on your chair to make sure that it has can put you in that appropriate position. And of course, you may have to experiment a little bit with chair positions. It's not as though we can necessarily say that we can make one adjustment and then it'll be good forever. No, you change, things change, circumstances change, or if you're in a fixed position for a long period of time, that may also require some modifications. So being able to have the appropriate adjustments and equipment helps. For example, a footrest if your legs are very short. These are some of what we consider to be ideal chair features, and all of you are not going to have all of these features in every chair that you're ever using, but there's some of the things that we try to look for when purchasing, is looking at putting a more ergonomically designed chair at your workstation. 5-caster base, height adjustability, seat depth adjustability, because we want you to keep your rear end into the seat, into the saddle as far as possible. Rounded edges in the front to keep from pressure being placed on the back of your knees. Armrest adjustability. Sometimes the armrest can actually be a problem if by putting your arms on there it forces your shoulders to be too high, or if the armrests are too high and you can't get the seat properly under your desk. those can be limitations. Those should be adjustable. And it should be padded if possible to give you the ability to rest your arms on the pads. Location of the monitor. Now many of you of course use computers, especially if you're working in an office environment, and the location of your monitor will help to keep your spine in that neutral position. So it should be directly in front of the keyboard. What we don't want you to do is have to turn and twist in order to see the monitor. It sounds easier than it is because I know in some cases people use more than one monitor. They may have two monitors and their laptop all in front of them. And so the idea is to try to get them at the same height so you're not having to look down or up, and you don't have to twist very far. Even by slightly moving your eyes, you can move from one monitor to the other. Generally, we recommend that your monitor be about arm's length from you, but that will vary with people and their eyesight. If you're wearing glasses, any sort of corrective glasses, then you may have to adjust that distance to be able to get the ideal focus. And the top of the screen generally should be at about slightly below eye level. That kind of puts you in the right position to be able to simply move your eyes to be able to see the monitor correctly. Now let's talk briefly about carpal tunnel, since that is one of the concerns that has really become an issue for us since the introduction of computers and many more people using keyboards. What carpal tunnel is an irritation of the median nerve, which runs through a tunnel, an opening, that is formed by this ligament on the base of your palm and upper part of your wrist. And through that tunnel passes the tendons that connect your forearm muscles to your fingers. But this nerve is also there, and that nerve goes to your thumb, your pointer, your middle finger, and the inside of your ring finger. That's where the symptoms usually would occur, and it's because if those tendons become inflamed, they swell up and begin to compress the median nerve. We do know that posture in terms of wrist is that your wrist should be straight and neutral. What does that mean? Well, straight is pretty obvious. Neutral means we don't want your wrist to be tilted in or tilted out, but rather we'd like your wrist to be in a straight and neutral position. Generally speaking, when we talk about carpal tunnel, we look at three of the risk factors we talked about earlier. Excessive force with your fingers, excessive repetitions with your fingers, or poor postural positions. Now the posture we just talked about should be straight and neutral wherever possible. Example, for some people, it is difficult for them to keep a neutral wrist because when they put their fingers on the keyboard, they have to do this based on their size and the size of the keyboard. Well, that is not a neutral wrist. So what we've done is developed a keyboard that has an angle to it shaped almost like a V, and the idea is it allows you to go back to the neutral wrist position. The other thing is the straight wrist. That's a fairly simple one to correct, because if you find yourself dropping your wrist when you type on your keyboard, get the little pad that you put in front of your keyboard, and it raises your wrist and won't allow you to drop your wrist into that extended position. Generally speaking, the treatments would be pretty straightforward. If you actually waited until the burning, itching, tickling, and numbness turned into pain and loss of strength, you may want to seek out medical advice, and if so, generally speaking, the process would be this. Doctor might put you in a splint to force you into a straight and neutral position, hopefully allowing the tendonitis in the carpal tunnel area to calm down. They may inject you with an anti-inflammatory like cortisone to try to reduce that inflammation. Or they may do a surgical procedure to open up the space to take the pressure off of the nerve. We don't want you to get to that point. We want you to be sensitive to what you're doing and the symptoms you're experiencing and make the appropriate adjustments long before it turns into a serious issue. Do have to understand that this is based to a large degree on how you use your fingers. If in the tasks that you're doing, your fingers are either being used forcefully, repetitively, or with a poor postural position, to understand your fingers, realize that although we use the pointer and thumb a lot, that's a fairly common combination of fingers, that's not very strong. The actual strength in your hands is in these three fingers, which are called the power fingers. So whenever you have an opportunity to engage those fingers, it will reduce the likelihood of experiencing fatigue because these are much stronger. So no matter what you are doing, a 2-finger pinch, we'd like to change at least to a 3-finger pinch to involve at least one of the power fingers. Or maybe we'd even move to a key pinch where you're simply leveraging your thumb against the side of your index finger. But wherever you can use the power fingers, or what we would call a power grip, which is all of your fingers and thumb, those are much stronger and engage the strength of your hands in using those particular grips. A simple exercise that you can do to try to eliminate or at least minimize the fatigue is by doing a simple stretch. Keeping your arms parallel to the ground at about shoulder height, you pull your fingers back towards your face until you feel a stretch in the muscles on one side of your forearm, and then you move back to neutral with a fist and drop your hands down, and that will stretch the muscles on the upper part of your forearm, both of which will help you relax those muscles, reestablish blood flow, and reduce fatigue. And that takes literally a few seconds and can be done multiple times during the course of a day. I mentioned before the postural positions. We want a straight and neutral wrist, and of course if you are tilted in or out, that puts you at risk, and so we might need an ergonomically designed keyboard. Or if you find yourself dropping your wrist, the little pad in front of your keyboard might resolve that. Even how you use your mouse is that there are positions where your hand and wrist is in a straight and neutral position as opposed to an awkward, therefore dangerous position. So always putting yourself in the strongest possible positions. You want to be close enough to your keyboard that again you can maintain that 90-degree bend at the elbow, and that your elbows stay beneath your shoulders, so it doesn't require you to reach out or have the keyboard too close to you. Repetitive motion almost seems obvious, especially in working on a computer or keyboard, because there are thousands, tens of thousands, sometimes even hundreds of thousands of keystrokes in a given period of time, which of course leads to the fatigue, which leads to the inflammation, which could lead to the carpal tunnel or other problems. So wherever possible, use technology. If you need to have, in order to correct your postural positions, an ergonomically designed keyboard or mouse or pad, use it wherever possible to help you to maintain those safe positions. Vary the tasks where possible. If you can avoid doing the same thing, maybe you'll do something data entry for a period of time, and then you can take a break by doing filing or some other task that changes the stresses on your body as you're doing this. And of course, even varying the methods of how you do things. Sometimes by switching some of the activities and how you do them might actually give you a chance to rest as well. And there, these technologies are things that you can investigate and try to find things that will help you to minimize the amount of force and effort you need to put in. I know you can't really ask questions or express your concerns right now, but I want you to appreciate what this is all about. It's trying to get you to take ownership of some of the things that could happen to you that would result in an injury and a loss of productivity. You need to know what you need to do to protect your body, and I hope in some way we helped you to do that. Thank you.